Sigmund Freud's impact on the field of psychology. By David Rashid Labiatrue. For Humanities 2250. Sigmund Freud was born in Freiburg, Moravia, 1859, and died in England, 1939. His family moved to Vienna, Austria when he was 4 years old. Sigmund Freud's medical background was a medical degree and PhD in neurology, 1881, from the University of Vienna. Freud did not like neurology, however, or what he wanted to do, and moved to Paris, France, to begin studying hypnosis under Jean-Martin Charcot. A year later, Sigmund Freud returned to Vienna, Austria, and opened his first medical practice focusing on psychology instead of neurology. It was in his first practice that Freud had concluded hypnosis was an ineffective method for dealing with emotional or mental illness, and had developed an alternative route. Sigmund began talking with his patients instead. He would encourage them to open up about their emotions, repressed feelings, memories, and dreams. He believed there was a link between the physical, emotional, and mental state, where one could affect the others much greater than previously believed. Freud believed repressing thoughts, or leaving them unaddressed, would hinder an individual, or even grow into what we know as mental illness. This technique is part of the basis of what would later be named as psychoanalysis, one of Sigmund Freud's most famous concepts in psychology. Psychoanalysis is a list of methods or therapies to bring out repressed emotional variables to a conscious level from an unconscious plane. It is also a set of psychiatric theories regarding how the conscious and unconscious mind interact with one another. As a form of therapy, it can be quite timely and expensive, taking up to 3 to 5 years in some cases. The main components of basic psychoanalysis is letting the patient open up about their issues themselves, sometimes letting them run freely about it, or encouraging them to talk more about it in depth if they are more withdrawn. There is no judgment or response or conclusion to the patient during the majority of these sessions, just listening and seeing how they react to their own emotions and memories to identify the root of the problem. Like many of Freud's theories and practices, psychoanalysis is not widely accepted or practiced today. It's considered very expensive due to how long it takes with modern insurance and not seen as accepted science in many professional institutions. It still does see some use modernly, however, as a treatment method for cases of anxiety and personality issues, but nothing like the extreme examples that Sigmund Freud based his theories on. Regardless of criticism, psychoanalysis' approach to the unconscious laid the foundation for other forms of mental health therapy. Tripartite psych. Freud believed that the human mind was sectioned into 3 different parts instead of just one whole unit. He believed that it was split between a simplified version of names by the id, ego, and superego. It could also be viewed simply as the id as the instinct, the ego as the controller of the id, and the superego as the moral conscience. When it came to psychology, the idea that the human mind had more than one layer that affected how we acted was another one of Freud's theories to which modern psychology has laid basis. The id. The id of the tripartite psych model represents humans, or rather animal instinct. The id is the only aspect, according to Freud, that humans have from birth. Humans develop the other two through age and experience. It represents physical desires that generate an impulse, including nourishment and sexual drive. It is impulsive and desires immediate gratification. It never grows or changes, unlike the other aspects. Considered unconscious fully, and thus uninteractable and uncontrollable. The ego. The ego of the Trinity represents the internal logic of the mind. It does not represent what is right or wrong, instead what is reasonable and unreasonable for the id to do. It acts as essentially a manager or limiter for the impulsiveness of the animalistic id. The id is uncontrolled, but the ego drives it strongly. Those with a weak ego or rationale, according to Sigmund, are very quick to self-serve. Freud also believed it was part of the mind that did critical social thinking. The superego. The superego of the tripartite psyche represents the morality of the individual. This is essentially where value develops for someone. Freud believed value only developed during a child's formative years, so raising a child in a proper household was important to ensure the superego developed properly with good morals. Parental or authorial figures play the largest role regarding the development of the superego at an early age. Freud and modern psychology. Sigmund Freud's theories with modern 21st century psychology are considered outdated, unscientific, and/or false, but it does not discount his greatest contribution to the field and how he challenged the field to look past the religious association and think there is far more to the mind. He is considered the father of modern psychology due to how much of his work became the basis of modern theory. His theories themselves, however, are largely not used today. Much of his actual work, however, is discounted, and is only taught out of respect and to show basis into the medical field or even a historical standpoint, due to the high lack of validity in many of his theories, as Freud based his work on his patients, many of whom happen to be outliers in regards to the majority. While many of Freud's works are discounted in 21st century psychology, he is still respected. The practice of psychology concludes Sigmund Freud did not figure out the human mind. It is accepted that he set us on the path to that answer, greater than any person.